Hi everybody and welcome to UroChannel. In my previous video, I explained how to treat lifelong premature ejaculation. This is a video about acquired premature ejaculation. If you don't know the difference, I really suggest that you watch one of my earlier videos where I explain the 4 kinds of PE. I will link that video at the end. Just click on it and it will play automatically. Acquired PE will need some diagnostic tests in the beginning because it is important to find the underlying cause. But before any test is initiated, it is very important to take a thorough history because it gives valuable information about the time of onset and whether there were any events and changes in the person's life that might have triggered the problem. A medical history also covers a sexual history to find out more about possible precipitating factors. These include duration of the relationship problems, performance anxiety, poor body image, and even fear of premature ejaculation. Ejaculation is a very complex process that involves the brain, hormones, and the sympathetic and parasympathetic nervous systems. What you need to know is this: the human body has not kept up with the cultural and developmental achievements of mankind. It has not arrived in the 21st century, but is stuck in the Stone Age. This means that we still own the same basic emotional reaction patterns as our ancestors. Any real or perceived threat will start the fight and flight program in our bodies. The sympathetic nervous system is in charge of that reaction. And guess what triggers ejaculation? Yes, it's the activation of the sympathetic nervous system. This is the reason for spontaneous ejaculations in sexually unrelated situations of extreme stress. Not a very common phenomenon, but every few years I get a patient with that problem. Another important area is erectile dysfunction. Sometimes these two problems coexist. This is something I typically see in men around 50. Additionally, men with ED might develop a pattern where they try to reach orgasm before the erection ceases. So at the end of the day, it is an erectile problem, not an ejaculatory problem. After taking a history, a physical examination including ultrasound is done. Here it is important to look for conditions that are linked to premature ejaculation, such as prostatitis, urethritis, and Peyronie's disease. I also look for signs of pelvic floor issues, as PE might result from pelvic floor overactivity, because like prostatic inflammation, muscle spasm is responsible for disturbing the normal sensory feedback mechanism. Additionally, lab tests are important, particularly assessment of thyroid function. So now I think you start to understand that the approach to acquired PE is much more difficult than what to do in lifelong PE. In acquired PE, it's the underlying cause that has to be identified, which is not always that easy. Once this has been done, then the underlying cause is treated. It is fairly easy in the mentioned combination of erectile dysfunction with premature ejaculation with an abrupt onset in middle age. Tadalafil works best in these cases and restores both erections and ejaculatory latency time. But certain things are difficult to treat, especially when sexual counseling and sex therapy is part of the strategy. Not everybody is suitable for these interventions, especially as sex therapy turns traditional thinking on its head. It is no longer the doctor who does something that cures the patient. In sex therapy, the doctor provides guidance and the patient puts in the work that eventually will lead to results. This approach is not suitable for everybody as it demands from the patient to take action for the sake of his health. Preferably, these psychosocial interventions are implemented within the couple as they are more effective this way. As I said, in acquired PE, premature ejaculation is the tip of the iceberg. But in contrast to lifelong PE, there is a good chance to make it disappear again, whereas lifelong PE will stay for life. If you don't know the difference between the 4 kinds of PE, I advise you to watch this video. Please subscribe to my channel, hit Euro like, activate the bell. Thanks for watching. Bye bye.